I want to go across now to one of the key architects of the government's strategy on dealing with the current lockdown and lockdown 2.0. He's been working non-stop over the last several weeks as part of the Prime Minister's core team. Chief Executive Officer and blue-eyed boy of the current dispensation, Amitabh Kant, now joins us. Mr. Kant, welcome. We will hope to have a more detailed conversation with you when the final guidelines for lockdown 2.0 are out. I want to start by asking you, what do you make of what's happening in Mumbai and in Ahmedabad? Like in Delhi, there have been some reports, even though they've been controlled right now, of migrants saying, please send us back home. Did you anticipate this? Are you concerned about this? How do you hope to contain it, sir? Welcome.
So Rahul, first and foremost, for any government, this is a very, very tough call. Making a call between, stopping the spread of coronavirus and curtail the transmission. And I think it's important to wait for some more time. We've done extremely well compared to European countries, but it's very important to wait for some more time. And a clearer picture would emerge in another couple of days, and that's why the Prime Minister said that it'll be a clearer guideline will be issued around the 20th. But it's important that this spread which is happening across is curtailed in a very, very tough manner, and countries which have not done this have paid a very, very heavy price. I mean, imagine America losing close to about 30,000 lives. Look at UK losing around 10,000 lives. And because we were able to take very firm, clear, and very tough administrative action, that we were able to curtail this down to 350. We are all fully aware that the people of India are suffering. We are fully aware that there are huge challenges in this. But this is a challenge which has to be met. And people of India must rise to this occasion, to the call of the Prime Minister, that it's very important to save lives from corona. Once it spreads all over the country, it'll be impossible to stop it. And we've seen this in the last few days, that it's very, very important to take very tough and firm action right now. Otherwise, we'll have reoccurrence again and again and again and again, and it'll be very difficult to put a lockdown on a later date. And therefore, it's better to be tough now and actually take all the harsh decisions at this particular stage. And simultaneously, the Prime Minister, as the FM had announced, put out this scheme for the Prime Minister's Garib Kalyan Yojana, through which we are trying to feed every single person. In addition to that, our challenge is to ensure that nobody remains hungry in this country, which is what we have done. We've got in touch with the states, we've got in touch with the district administration, we've got in touch with the 92,000 non-governmental organizations and the civil society organizations to take it as their responsibility. And all of us are working as a team to ensure that we take care of the citizens of India and of every single migrant laborer of India. We realize their pain, we realize their agony, we realize their difficulty, but it's more important that we do not allow this coronavirus to spread to the rural parts of India.
So at a philosophical level, explain the rationale in the total lockdown approach that India has gone in for. We've seen President Bolsonaro in Brazil say, I'll take it in the chest, my population is young, there will be some casualties, but you cannot allow the cure to be more dangerous than the disease. Why is it that not just the first time around with lockdown 1.0, now even with lockdown 2.0, we've gone for the maximum approach? Oxford University study says India has amongst the most stringent, so along with New Zealand, South Africa and India, have the most stringent lockdown in the world, and the 3.9 billion people globally who are under lockdown. Why do you believe this is the best approach for India, Mr. Kant?
Simply, Rahul, because India is not Brazil, India is not Italy, India is not Spain. We are a country with a 1.4 billion population. We are very, very dense, especially in urban areas. We are extremely dense, and it's very important that tough measures are taken in the initial stages, because once this coronavirus spreads, we are not able to do social distancing, we are not able to wear masks, and it'll be very difficult later to stop it. There is no vaccine available. And therefore, philosophically, as you said, it's very important that we use, as one of the Stanford data scientists, Thomas Pio, said, it's better to use the hammer approach right in the beginning. Prepare yourself for the hospitals, prepare yourself for the COVID hospitals, for your wards, for your PPE, for your testing. All that needs to be geared up in a large country like India. And that is what this hammer approach has enabled us to do, to ensure that we are fully geared up if and when this crisis ever arises, even at the peak. And you look at several models of epidemiologists. We've looked at 8 different models of epidemiologists. And the figures have gone up to close to 3 lakh a day at its peak, from 1.5 lakh to 3 lakhs a day spread of infection. And therefore, it was very important that the government is not only prepared, but fully over-prepared to meet this crisis.
Sir, you've been giving inputs for Stimulus 2.0. We had Dr. Rajiv Kumar, Vice Chairperson of the NITI Aayog, with us. He said on our interview that before the announcement of the lockdown, there's likely to be some kind of a stimulus announcement. Now, I know you can't give away the details of what the stimulus contains, but can you give our viewers and everybody who's watching a broad sense of the groundwork that's been done, and by when do you hope that we'll see the second fiscal stimulus that everyone's talking about?
No, the Finance Ministry has done a lot of work on this, and I think a lot of input has gone from several quarters to this, and the government is fully conscious of the fact that there is, we need to take care. This is an unprecedented crisis of its nature. We need to take care of our medium and small industries. We need to take care of our large industries, and we also need to take care of several sectors like the hospitality sector, the airline sector, the construction sector, including textiles and many others, which create vast number of jobs. And if we do not care, we'll suffer in the long run. But we are fully geared up for this, and I think at the appropriate time, the Prime Minister and the Finance Minister will announce the right packages. But we are absolutely sure that we are on the right track as far as these are concerned, and the Finance Minister has done a lot of debate and discussion around this.
What's your view on the migrant situation, sir? How do you ensure that those, there are two dimensions to this. One, in rural areas, those who are farmers under the Kisan Yojana, you've got them mapped, you know what their bank account numbers are, you've sent money into their accounts, you've had instances where they were bogus farmers, you had an opportunity to remove them from your list. So you have a fairly, not perfect, but a robust list. When it comes to urban unorganized labor of the kinds that we saw out on the roads in Delhi and Mumbai, you don't have that kind of a mapping. They're the ones who've been dispossessed, they're the ones who have no pakka jobs. How does the government hope to take care of them, sir?
So, Rahul, there are two things that all along we worked in very close partnership with the states. We've worked in very close partnership with the district administration and the non-governmental organizations as well, as far as the migrant labor is concerned. And therefore, I think we've, in the last few days, done a lot of mapping of migrant laborers across the country. And I think we've got fairly reliable figures on that. We're still working, but I think we've done a lot of spade work on this. But more important than that, across the country, I think states after states after states have taken care of the migrant laborers and actually provided them all possible assistance in terms of housing, in terms of shelter, in terms of food, and in terms of water. And everywhere, and we've been constantly in touch with the district administration, every single one of them have really collaborated to ensure that the migrant laborers are taken care of. But it's a challenge, it's a human challenge. I mean, we've done this for 3 weeks and another till May 3rd. It's a human challenge. And as the Prime Minister himself said, that this is, he requested it, it's necessary for the country to protect and save your country. This is imperative that everybody does it for the sake of the country. Because imagine if the migrant laborers were to carry this infection to the rural area, and once it spreads to the rural areas, and some of our rural areas, and since I look after aspirational districts of India, I was looking at the 112 aspirational districts of India. Imagine these are some of the most difficult, some of the most poor districts of India. Imagine if this infection was to spread into those areas. We'll never ever be able to excuse ourselves. We'll never ever be able to protect these districts ever again, and we'll be putting them into backwardness and poverty for a very, very long time. And therefore, it's better to be tough. It's better to be very, very firm at this stage. Some people are suffering. We realize this. There's a great human angle to it.
And
We
before I
realize
let you
that
go,
there's
Mr.
suffering.
Kant,
But
what's your message to everyone who's watching? What's your message to everyone who's watching? What is, in your view, and since you're so closely involved with this process, what is key to India taking on the coronavirus, fighting the coronavirus and flattening the curve? What do people need to do? How important is state-center cooperation? What is the most important thing?
I think first and foremost, Rahul, we must all realize that lives have changed, the way we live has changed, and it's very important that we maintain social distance and we wear masks whenever we are in public. We must do this. It's very important. It's incumbent upon us to do this. Number two, it's very important that it'll be very difficult to break this by just physical means. It's important to break this intelligently and through the use of technology, and therefore what the Prime Minister talked about, the Arogya Setu app, and it's a very, very simple, very easy app to download, and it's based on a privacy-first model, and therefore every single Indian must download this app to enable contact tracing far more easier, because if there's a hotspot, we'll be able to figure out very immediately, and we'll be able to do contact tracing very easily. Thirdly, I think a lot of people may be suffering because they're not able to do face-to-face consultation with their doctors. The government has come out with a new guideline on telemedicine, and I think it's very, very easy now to consult doctors legally through the use of their mobile telephone. Just take a photograph and send it off and do mobile telephony with your doctor. And fourthly, I think it's very important to tell people that actually the real warriors in this whole battle are the doctors, the nurses, the frontline workers, and we must take care, must respect them, and must ensure that they are fully protected in this battle.
Mr. Amitabh Kant, I hope to have you back on our network to talk about the guidelines and explain what you've done and why. But once those guidelines are out, for laying out the broad philosophical framework of what's being done and why, deeply appreciate you joining us, Chief Executive Officer of the NITI Aayog, Mr. Amitabh Kant, stepping out and joining us on this conversation. We hope to have him back once we know what the government is doing and how Lockdown 2.0 will be operationalized after tomorrow. Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.